Well, knowing the difference between virtual care, convenient care, or emergency care is so important to get you the right type of care. And not all injuries and illnesses require going to the emergency room. For more on knowing which of these care options you should choose and why is Dr. Doug Pogue, who's the president of BJC Medical Group. Dr. Pogue, thank you for being here with us today.
Yeah, thanks.
There's several options when you get sick. So right now, let's talk about emergency rooms because we've got flu, RSV, COVID. Are they filling up?
There's a lot of illness right now. And so most of the emergency rooms in St. Louis are just jammed. They're overloaded with patients. There's long wait times, and it's very difficult to actually get seen and get what you need from an emergency room. So if you have a dramatic emergency, that's what the emergency room is for. But people really should try not to go to the emergency rooms unless you're very, very sick.
And could you compare this to in the pandemic when were emergency rooms full then?
They were. So we've got a reasonable level of COVID right now. It's kind of leveled off here through November and December. Flu is rising. It got really high after Thanksgiving and is kind of leveled out here between Thanksgiving and Christmas. And then RSV, thankfully, is slowly going down. So we're seeing a little bit less of that. So the children's hospitals are in a little better shape. But there's the normal illnesses that happen to people on an everyday basis. And when you add all of the acute illness between COVID and flu and RSV, it really overloads the system. So it's very difficult for the emergency rooms to operate right now.
And I think especially since the pandemic, for some parents, it's scary when your kid gets really sick and they want to take them to the emergency room, but that's not always the best option. What are some other options?
Yeah, we can get you better medical care that's much more convenient, effective, and then honestly, a much better value if you go to other places. So I'll start off with virtual care. So if someone has got a mild or moderate illness and you just want to find out, how do I get checked out and understand that if I'm doing the right thing? For instance, if I have COVID, should I take Paxlovid or should I just kind of stay at home and be supportive and get through it that way? If I have flu, should I take Tamiflu or not? Do I need an antibiotic? Questions like that are great for virtual care. And it's easy to do. You can go right on a website. Ours happens to be bjc.org. You click on virtual care and can either get in line right away to be seen or pick a time later in the day. And so those kind of things where you can talk to a doctor or a care provider, understand what you should do and get the right advice, quick, simple, easy. And we've actually allowed all of our doctors' offices to do both virtual care and in-person care throughout the course of the day. So you don't even have to get virtual care from someone you don't know. You can talk to the care team that already knows you and get virtual care that way. It's a nice option.
I'm sure that's always why people are hesitant for that because they think the emergency room will be quicker, but you're saying maybe even the same day you can get virtual care?
Absolutely, and that's the best value. It's the least amount of money for the best advice for what you have.
Okay, so we've got emergency room, we've got virtual care, and what is convenient care?
Yeah, so convenient cares in your doctor's offices are places where you go where you're a little sicker. For instance, if you're ill and you feel like it's really getting down in your lungs, maybe I have asthma and I'm really worried that my asthma is going to flare up and I want someone to really check me out, listen and understand what's really going on. That's where the convenient cares are around town that you can just walk into or schedule online for an appointment, the same way you do with the doctor's offices. So you go in, you can have somebody personally check you out and just make sure, okay, do we need to do something more aggressive here or is usual care okay? So it's nice when you're kind of moderate illness or if you have medical problems where when you get sick, you get really sick, so you want someone to check you out directly.
It seems every year at the beginning of winter, the holiday season, people start to get sick. So this is great information, especially before we go spend time with our families. Thank you so much for being here with us today. Dr. Pogue is here, and we're going to post everything he just said because it was so important following the show at kmov.com/greatday.